Hey everyone, Dr. John Burroughs at Springs Aesthetics. We're coming from one of our operating suites. I wanted to talk about the differences between CO2 laser skin resurfacing and radio frequency skin tightening and resurfacing. They both work well. The CO2, an advantage is that it's more customizable, so you can go anywhere from 50% density up to 90-95% with our unit here. And basically the laser is delivered through this handpiece. It's got a nice guard, so it's at the appropriate focal distance, and you can treat large areas of the face very quickly. Now, the CO2 laser will not reduce fat, and it's more of a resurfacing of the skin texture. It doesn't tighten near to the same amount as the radio frequency approach does, which uses these fractionated needles that come out that are attached to this handpiece. Because the energy goes so much deeper with the radio frequency, you can not only tighten the skin more, but you can also address some unwanted fat. Now, it doesn't replace liposuction, but for small areas of extra fat, like in the jowls or under the chin there, it can work well if you have mild to moderate amounts of fat. The CO2 laser is more on the superficial level. With that said, we often will do a combination approach where we get more of the tightening with the radio frequency. Ours is the N-mode Morpheus unit. And superficially, for like fine lines around the lips, you can use the laser. And so they work well together. Now, in times past, I started doing CO2 laser resurfacing in the late 90s. All we had was 100% ablation. So the whole area that you treated, all the skin was addressed, which may sound good, but it really prolonged healing times to where you could look quite unsightly for a few weeks. With the fractionated approach, where it's like this, where not every single spot is being treated, it's got little areas in between, so the healing is a lot faster and risk for pigment changes and prolonged redness of the tissues is much less. Now, the CO2 laser, though it's more customizable, it still takes longer to heal unless you're just doing a very superficial minimal density treatment, whereas the Morpheus, in about 5 days, you may have just a little redness left, but you're pretty much healed, which is really nice because it can still be, depending on the energy level and the density we use with the CO2 laser, 7 to 10 days before the skin is turned over. So we like to do 3 treatments with the laser about a month apart, maybe 6 weeks. We find that doing those, it gives an additive result with a very safe profile and a good healing time. And those results will usually help you for a few years if you take good care of your skin, use good sunblock, use good antioxidants and moisturizer. However, a lot of patients like to get a single touch-up at about a year just to keep the maintenance going. They don't have to do the whole series though. With the Morpheus, we also like a series of 3. You do them a month apart, not 2 months, because the healing is so much faster, and then you're good for a year or 2. However, most patients, because they love the results so much, they want to maintain it, not let it drop off at all. They come in 12 to 14 months to do a single treatment. And again, that's taking care of your skin. You want to protect your investment. So I kind of wanted to talk about those differences, and I hope everybody found that helpful.